Hi, my name is Setri Fugar. I'm one of the cardiology fellows from Rush University Medical Center. I have the honor of being able to interview Dr. Deepak Bhatt from Brigham and Women's Hospital and Harvard Medical School. This is ACC 2019. Dr. Bhatt, it's a pleasure.
Great to be here with you.
Thank you very much. Question for you, what are you most looking forward to at ACC 2019?
Well, I guess I was really excited about the whole Apple Watch study. That's something I think lots of people and patients have been anticipating. There's a lot of folks out there using these devices, and I think doctors have wanted data, and now we have some data. So I think it's a great first step in trying to evaluate these technologies in a more rigorous way. Bottom line is patients and just even healthy people are going to be using them anyway. This sort of data is going to be coming into our offices, and now at least we have some sense of the quality of the data and what we might be able to do with it. So that's perhaps what I was most excited and waiting for. The TAVR trials obviously have been a much anticipated set of data, so seeing the data now is really quite exciting also.
That's great. Are you a little nervous about the patients having this watch, telling them about AFib and like the patient burden and patients just being overly anxious about knowing all this information?
Yes to all of that, but the reality is it's coming, it's the future, so no point worrying about it and trying to ward it off, because even if doctors say don't do it, patients are going to be using these technologies. It's sort of like, the Google search. I mean, that's how patients often get medical information. In fact, that's how doctors often get medical information. So, that's just life. It's not so much, I think, fighting change, but rather adapting to it and figuring out how can we help patients with this information and maybe keep them from hurting themselves. That is, you're right. Sometimes it might just lead to unnecessary anxiety or worry or unnecessary testing with its costs and potential risks. So, yeah, it's a great new world we're entering in terms of all these things going on with apps and wearables and AI, but that's, I think, a good and exciting thing about being a fellow in training. You're going to get to be part of all this evolution of cardiovascular medicine.
Wonderful. So I know Harvard is always their lead in terms of technology and in terms of healthcare. Just wanted to get an idea, how is Harvard Medical Center integrating digital media more and more each day into the management of their patients?
Sure, it's a terrific question. We're doing a lot of stuff. We're certainly researching AI and deep learning and the sorts of things that have excited many people. We're trying to evaluate those things rigorously without hyping them. There's been a lot of hype in the field, and that always hurts the field more than it helps it. So, we're, I would say, in a stage of evaluating these things in a, skeptical way, trying to see are there ways to bring these different new techniques to healthcare in a way that actually helps patients and doesn't just add either to the physician burden or just create chaos. So, that's one sort of example. Other things we're trying to use, not just text-based AI, but even imaging, and trying to integrate AI with evaluation of the large amount of imaging data in medical records along with text to see if integrating that aspect might produce better predictive algorithms in terms of who might get sick, who might get rehospitalized. So some sample of things that are going on there.
All right, thank you very much. I think we've asked enough questions. Just want to say thank you very much. I look forward to hearing other presentations you have, including the one on ticagrelor and reversal agents, and thank you very much.
Yes, really great speaking with you. Thank you.
Thank you.